The auto ankle rules are to see if radiographs of the ankle are indicated. So first of all, tenderness along the tip of the posterior edge of the distal 6 centimeters of the lateral malleolus. So that would be about right there. And then tenderness along the medial malleolus, just here, and or the inability to bear weight for 4 steps at the injury or in the ER. Radiographs of the foot are indicated if tenderness at the base of the 5th metatarsal, which is about right here, or tenderness at the navicular, which is here, and or the inability to bear weight for 4 steps at the injury or in the ER. A positive prone instability test, a straight leg raise greater than 91 degrees, age less than 40, and aberrant motion. Symptoms less than 16 days, no symptoms distal to the knee, hip internal rotation less than 35 degrees, hypomobility segment, and FABQ score less than 19. This is the McMurray's test for meniscal pathology. Externally rotate the tibia, and then I'm going to provide a valgus force. I'm going to slowly go into extension. This is for the medial meniscus. And then for the lateral meniscus, I'm going to have an internal rotation of the tibia with a varus force. I'm going to put the knee in about 20 to 30 degrees flexion, hold the femur, stabilize it, and I'm trying to anteriorly translate the tibia. The lower limb tension test that I picked is the straight leg raise. With the straight leg raise, looking for a patient to have symptoms within the first 30 to 40 degrees of passive range of motion here. Pain aggravated with squatting, lateral or anterior hip pain with the scour test, pain with active hip extension, pain, lateral pain with active hip flexion, and passive range of motion of hip internal rotation less than 25 degrees. Differential diagnosis for a gluteal or hamstring weakness versus an L5 or S1 radiculopathy. So gluteal and hamstring weakness would present with no specific myotomal, reflex, or sensation deficits, possible reduction in active range of motion of the hip extension and abduction due to weakness. And then you will have the slump test, the straight leg raise, and the well leg test should be negative. The only weakness should be in the hamstrings and gluteal muscles. For the L5 S1 radiculopathy, that would present with myotomal weakness in great toe extension, which is the L5, and then plantar flexion weakness, which is S1. Sensation deficits will be in the lateral half of the distal foot and leg, so that would be here through here. Absent would be the S1 reflex, which is the Achilles reflex. There will be weakness of the hamstrings, glutes, peroneals, gastrocs, soleus, and extensor hallucis longus. There will be possible deficits in the lumbar spine with active range of motion due to pain. There'll be possibly radiating pain in the leg. And then the special tests that should be positive are the slump test, straight leg raise, and possibly the well leg test. especially if it is due to a large disc herniation. So I'm going to perform the slump test here. All right, Sean, what I'm going to have you do is put your hands behind your back and then just slouch over and then put your head down. I'm going to apply some overpressure. Extend your leg here. Feel any symptoms here?
Nope.
Okay. And then how about now? Okay, great. Now we'll just compare the other side. Going to apply some pressure here. We're going to straighten your leg out. Do you feel anything here? Okay. And then what about now? No? Okay, great. You can sit on up. So that was the slump test, and that was negative.